bleeding, you hit your head, vehicular accident, you lost a lot of blood. Clear? Choking. Clear? Okay, now let's go to asthma. What is an asthma? Are you familiar with asthma? Asthma, what is an asthma, guys? In your own understanding, what is an asthma? Very good. If a person is suffering from asthma, he, if a person is suffering from asthma, automatic he's having a difficulty in breathing. Right?
Yes.
Clear? But how you will know? Ask the victim. Sir, are you suffering from asthma? Do you have an asthma? Yes. Where is your medicine? Ask immediately the medicine because we don't have a first aid for asthma unless you have inhalers. Okay? Now, what's happening to you if you're suffering from asthma? Difficulty in breathing because the passageway of air becomes small. Restriction. Who restrict? What restrict the passageway of air? We have a lot. Dust, pollen, stress, right? Food. We call this CRPD. Okay. First of all, what's happening if you suffer from asthma? Difficulty in breathing. If you're having a difficulty in breathing, the passageway of air becomes smaller. That's why you have wheezing sound, right? What will happen if your oxygen decrease? What will happen to your face? Change of color, right? What will happen to your fingernails? Change of color. You will suffer from cough, exhaustion. You see the shock stage? Carbon dioxide increase, your heart rate will increase until such time that you pass out, right? Okay. Asthma is a reactive airway disease. Reactive airway means it can reactivate any time of the day. There's no warning sign. We have two kinds. CRPD, COPD. Restrictive, chronic, restrictive pulmonary disease, chronic, obstructive pulmonary disease. What are the two kinds of asthma? Abdullah, CRPD and COPD. These are different. CRPD is the most common type of asthma. CRPD is triggered by environment. Anything that you can see, madam, in the environment that can cause you having a difficulty in breathing, that's what we call asthma. It's restricting your breathing. Give me one. What? Dust. Very good. What else?
Drinks, or
Hmm?
sea, or temperature, drinks,
Pollen. Let's say pollen. What's that? Temperature? Okay, humidity, right? Change of climate. What else? Stress. Delayed salary, right? Sometimes you don't know that one. Stress. What else? How about allergens? Food. Hazards. Okay, my question is allergy as a food poison? No. Okay? Remember that, huh? Allergy is not a food poison. When we talk about food poison, it means to say that the food is not properly prepared. It's either the temperature is not correct, right? So you follow the temperature, how you cool the food after cooking, multiplication of bacteria, but when we talk about allergen, it's not a food poison. Here, for some of the locals here, if they suffer from allergy, this hotel poisoned me. I encountered that before, guys. It's not a food poison, okay? All right. Stress, what else? Chemicals, exercise,
Means heavy exercise.
any exercise, improper exercise, fatigue. So anything that can trigger by external environment, we call that CRPD. The problem with CRPD is you don't know, Abdullah, what triggers your asthma. You have no idea. All right? Now, do we have a first aid?
Yes.
What's your first aid, sir? Very good. Inhaler. We have two kinds of inhaler. Watch out. Preventer and reliever. What's the difference between preventer and reliever? Okay. For example, Samuel, right? For example, Samuel, you notice that why is it every time I go to duty, I'm having a difficulty in breathing? Maybe because of the carpet, because of the dust. So you go to the doctor. Okay, Samuel, you're suffering from CRPD. You have a chronic restrictive pulmonary disease. You're suffering from asthma. So first, I'll give you the preventer. The preventer medication is like this. Before you go to work, you take the preventer. The preventer will help you to prevent the attack of the asthma, but it's a limited time only. 4 hours, 8 hours, it depends about the prescription. But what if after 4 hours or 8 hours you forgot to take your preventer and the asthma attacks? Do you think the preventer will work? What medicine do you need? Reliever. Okay, so if there's an asthma attack, you have to check for the, madam, where is your reliever medication? I don't have a reliever medication. I forgot it at home. You have the oxygen. Oxygen is a reliever. Okay? Nowadays, some doctors they stop to prescribe the preventer because preventer has a drastic side effect. We have a side effect for this. This is a steroids. You know, every time you take the steroids, you get big, right? Cushing syndrome, and at the same time, your immune system becomes weak. Okay? So that's why some of the doctors prevent this one. It depends on the doctor. But usually they give the reliever. Wait for the attack, and then when the asthma attack, you take the reliever. Okay, now, you have one guest. The guest is suffering from asthma. You're the guest. This is the reliever. Okay, madam, please puff. After 2 minutes, observe. If the asthma continue, you give another puff. Alright? Second puff already, right? After 2 minutes, if the asthma continue, you give another puff. Call 999. Here, it means to say that the asthma attack is progressive. It cannot be relieved by a reliever. So what are you going to do? While calling the 999, sir, I already gave the reliever 3 puff, but nothing is happening. Okay, just continue to give the reliever every 2 minutes. You can finish the whole medication in 1 hour. 16 puff, 20 puff, it's okay. Alright? Because when the paramedic arrive, they will inject the epinephrine. Epinephrine or EpiPen.
So it will be give immediate.
Immediately it will be relieved. Because it's only one. restriction. I just need to lift the
Release.
restriction and then you breathe normally. If you have the oxygen, you give the oxygen. Why? What's happening again in the shock stage?
Oxygen level.
Compensate this one. Give oxygen. Here, right? Okay, now,
Sir, question.
go.
Preventer inhaler is not included in the first aid box.
No, because that's a good question, guys. Because this is a personal use. If you're suffering from asthma,
Yeah.
you should be responsible that you have your own reliever. But what if, sir, I don't know if he's suffering from asthma? That's why in the hotel you have the
So you should give oxygen.
oxygen. Because if someone is suffering from breathing problems, guys, any kinds of breathing problems,
Oxygen.
oxygen. Clear?
Where we have this?
Clinic
Clinic.
and security.
Okay? I'll show you how to use this one later. It's very easy. Alright. If this is restriction, this is obstruction. This is caused by bacteria and viruses. If the bacteria and virus enters your body, what will happen to you? You will have a fever. Am I correct?
Yes.
Right? If the bacteria and virus enters your body, you will have what? Fever. Do you have a fever in asthma?
No.
No, because this is not a viral and this is not a bacterial infection. Okay? This is a reaction from your body. Your histamine level is not that normal. Are we clear? So what's your first aid in asthma? If you have a guest, he's sitting down in the lobby and then suddenly he's having a difficulty in breathing, the first thing that we need to ask, sir, are you an asthmatic person? Yes. Where is your medication? It's in my room. Give me the key, I'll get the medicine. Clear. Ask someone to get the medicine, reassure the victim. Stay calm, deep breathing. And we get the medication. And then you start to cough. Okay, 1, 2, 3, sir, cough. Okay. Breathe normally. If nothing happens, give another second shot. After 2 minutes, second shot. After 2 minutes, third shot. If nothing happens, if you have the oxygen, please get the oxygen. You give the oxygen, then call 999. Sir, I have one guest here, he's suffering from asthma. We already gave the oxygen, and he's still having a difficulty in breathing. Okay, the paramedic will tell you, okay, just continue the oxygen and give the reliever. Here, you can finish the whole medication in 1 hour, don't worry. Don't overdo.
Is it medication against?
We're not allowed, usually for asthma, it's inhaled. Inhaled. Okay? When the paramedic arrives, inject. We call that the EpiPen. In some restaurant, in 5-star hotel here in Qatar, we have EpiPen. Because if someone suffers from allergy, we have to inject EpiPen. Okay?
But it's only by paramedic.
Nurses. It can be administered by the nurse or paramedic. In school, they have the EpiPen. You see, children, they are more on allergies. Clear? Are we good? You understand this one? Sir,
Yes. Yeah.
CRPD, understood? Okay? Alright. Now, let's go to your CPR. Okay? You only have two options in CPR. Number one, 100 to 120 chest compression. Number two, 30 compression and 2 ventilation. Four times in 1 minute. Okay? Again, guys, this is optional. You're the rescuer. If you want to apply rescue breath, it's up to you. If you don't want to apply rescue breath, it's up to you. But do not forget the 100 to 120 chest compression. Okay, follow this one. Danger, response, airways, breathing, circulation, defibrillator. How are we going to perform this one? Okay, we're going to do rescue group. You belong in one company, you choose your partner. I'm going to demonstrate how you will perform. Okay? All right. Let's do the 30 compression and 2 rescue breath. You know how to use this? Okay. How you will use this one? You open it, place it in the mouth. How you will apply rescue breath? Pinch the nose, chin lift. All right? Chin lift. Pinch the nose, chin lift, and that's the rescue breath. Okay, now, how you will apply the chest compression? You nipple line, lock your elbow, lock your shoulder, straight, then 30, and then 2 rescue breath. Clear? All right, now, sir, you'll be my assistant. We're going to do 2 rescue. 2 person will rescue the victim. All right, so this is the AED. You have AED, right? Okay. If the AED arrive, all you have to do is to turn on the AED, and follow the instruction. It's very easy. Okay? The first thing that you need to do, if the AED arrive, turn it on. Clear? Okay. Are we ready? All right. We have one victim. You enter the conference room, you have one victim. Hey sir, are you okay? Hey sir, are you okay? Remember what did I told you? Do not approach the victim when you are alone. You have to get what?
Witnesses.
Very good, check. We have to get for a witness. Sir, are you okay? Hey, sir, are you okay? The victim is unconscious. Leave him. Sir, please follow me. Security, follow me. We have one victim in the conference room. The victim is unconscious, not breathing. So we approach. Hey, sir, are you okay? Hey, sir, are you okay? Sir, sir, are you okay? Hey, apply pain. He's not responding. Okay, let me check the airway. This is how we check, all right? Sir, are you okay? Hello? Listen. He's not breathing. Bro, he's not breathing. So you get the AED, you call 999 and get the first aid kit. Clear? My instruction is clear, right? Get the AED, call the 999, you call the nurse, and get the first aid kit. Now, what should I do? Sir, I will apply my chest compression. How many? 32. Okay. Now you get the AED. You remove it. Don't plug it. Okay, the AED arrived. Sir, please stay on my side here. Turn on the AED. Don't stop. The green button. Okay. Yeah, it's okay.
Apply pads
Apply
to
the
patient's
pads now.
bare chest. Plug in pads connector next to flashing light.
So it is okay after.
Apply pads. Plug in connector.
Okay, what's the next command?
Plug in.
Okay.
Analyzing heart rhythm.
Stay here.
Do not touch
Okay.
the patient.
So I'll apply the chest compression. You apply the rescue breath.
Shock
After you
advised.
cycle, you apply the chest compression, you apply the rescue breath. Clear?
Stay clear of patient.
Listen to the AED.
Deliver shock now.
I'm clear.
Press the orange button.
Press it.
Yes.
Shock delivered.
Ready?
Begin CPR.
Ready.
Open this.
Rescue breath. Pinch. Lift. Go. Two short breath. Okay, one. Low. Rescue breath. Two short breath. Okay. Rescue breath.
Number one.
Okay. Chest. Okay, compress the chest. Go.
That's it. Take 21. 30.
Compress.
I guess we
7, 8.
This is how you do, huh?
21. 30.
Compress.
Analyzing heart rhythm. Do not touch the patient.
Don't touch.
No shock advised.
No shock advice.
If needed, begin
How will
CPR.
I know if you need CPR? How will I know if you need CPR?
Breathing or not?
If the victim is breathing, do we need to apply CPR? Okay, check the breathing. Victim is breathing. Recovery position. Do not remove the AED because this is a universal port. If the paramedic arrive, they will remove this one. They will connect it to the ECG machine. Clear?
So,
Are we clear? I want to see that later.
this one, so
Okay.
we need to do both parallel. Because initially what I thought, AED, when we have AED, I don't need to do this one.
No.
So it has to be parallel.
I will explain to you later after this what is an AED, why do we need to use AED, okay? Are we clear? Any question? Did you see what we did? It's very smooth, right? Very smooth. I applied, how many compression did I apply? 90 compression. 90 compression. And it's not enough. Because in 1 minute, how many? 100 to 120 compression. So it means to say, I'm too slow and he's too slow. You have to compress the chest very fast, but do not use your arm. You have to use your shoulder, not your shoulder, body weight. Okay? You have to break the ribs. If you break the ribs, you're in the right path. Nowadays, when I was practicing paramedic, we use the machine. The machine, the machine is more fatal because the machine will hit soup. At least, if human, you can feel the broken bone. At least you can light it, but the machine, no holds bar.
This is a CPR machine.
Yes, we have. We call it the Lucas machine. We're doing that right now. But if we apply that to you, you break all your bones.
That machine.
Yeah.
But it will, anyway, the bone will come.
Well, I'll let you choose. I'm not going to touch you, but you're going to die. I'll break your bones, but you leave. Clear? Alright. You think this is important?
Very good.
Very important. What if you don't have the AED?
Instructions.
Let's give it a little advance. You don't have the AED. You check the airways. Not breathing. Not breathing. You don't have the AED. What are you going to do?
Check.
You bang the chest. When victim is breathing.
When after
In the beginning.
In the beginning. If you bang the chest, victim is not breathing, start your chest compression. Clear? Okay, what is that and what is this?
Pressure.
We call that the precordial thumb alternative for AED. It can give 10 joules. That's normal. We usually do that. It's legal. Okay? It's legal to break the chest. 10 joules here. Why do we need to restart your heart? Because your heart is swung by electricity. You have the old television, you have to kick it, you have to bang it, and then
Yeah.
it will work properly. Okay? Are we good? Any question? You see what we did? I want to see that later. No mistake. You only have one chance, believe me. You only have one shot.
A question.
Sir,
In case you don't have this AED machine, so as you mentioned, this is we have.
if you don't have the AED machine,
Once?
30 compression to rescue breath, 30 compression to rescue breath.
No, initially you said this.
Yeah.
Once only.
Once. Boom.
Then you start to
Yeah.
CPR.
Anyway, when we see, we check first we check the response of the guest, then we check
No
the
response,
breathing.
you apply A. If you're not confident with this, listen, you can feel the air, right? Not breathing, 10 seconds. Don't check the pulse. Check if the lungs is rising and falling. Don't check the pulse. Why? Bro, sometimes you are on a panic mode. If you check the pulse, believe me, he's having a pulse. You hear your own pulse. You can hear your own pulse. It happens to me a lot of times. I check the pulse. There's a pulse, but the victim is not breathing. But I'm hearing my own pulse because I'm on a panic mode. Clear? So what we did, the same thing that you need to do during your practical exam. Clear?
Yeah.
All right. Now let's go to AED. AED. Normal heart rhythm. This is your normal heart rhythm, guys. You can see this in your ECG choice, right?
Yes.
This is normal, right?
Yeah.
It's normal. What do you call this? This is the electrical activity. Okay? This coming from your sinoatrial node. This is the battery of the heart, sinoatrial node. Okay, now, you suffer from injury. Okay? When you suffer from injury, what's happening to your heart rate?
Go high.
Go high. Alright. It's either you suffer from VTAC, ventricular tachycardia. Tachycardia means increased heart rate. From the normal heart rate, your heart rate will become like this. Is this normal?
No.
Do you think you're breathing? No. Your heart is jiggling. Right? But you are for sure, you are unconscious already. After 10 minutes, boss. The next is what is VFib? Ventricular fibrillation. Is this normal?
Still not normal.
Still not normal, right? How about this? Pulseless electrical activity. Is this normal? Where's the normal here? And what is this? Okay, where can you find electrical activities? Let's identify. Where? Do we have an electrical activity here?
Yes.
Yes. How about here?
Yes.
How about here?
Yes.
How about here? The AED will work as long as he detects any electrical activities. This is automatic. He will detect this one, he will detect this one, he will detect this one. The one that we are using in the ambulance is manual. That's why we have to look for the monitor. We're looking for the monitor because I will look for this, I will look for this, and I will look for this. If I see any electrical activity, give me 300 joules right away, boom. Okay, another joules, 300 joules right away, boom. As long as I can see electrical activity, I will try to restart your heart. But it's not a guarantee. For example, you apply the AED, boom, the heart will restart. Flatline for 2 minutes, apply CPR, right? We apply CPR, two. And after that, the AED will, you're lucky, you're alive. You got it? Now, the AED detect this one. The AED says, prepared for shock. Press the shock button. Boom. After 2 minutes, you're lucky you're alive. As long as there is a electrical activity, we can restart the heart. How about this? We can still restart? Yeah. Boom. How about this one? We cannot restart. Why? Can you see electrical activity? No. Can we force the heart to give electrical activity? Yes. If the paramedic arrive, no electrical activity, let's give epinephrine. We will inject medication. If we inject medicine, what will happen to the heart? The heart will give us electrical activity, and if we see that electrical activity, we start it. You got it? You got it?
Yes.
So that's why AED is very important. 60% chances of survival if you have the AED. Clear? You understand? This AED will not work if you place this AED in a dead person. Why? The AED cannot detect any single electrical activity of the heart. But as long as your AED detect this one, detect this one, detect this one, it will shock, shock, shock until you burn your chest. That's the problem with AED, you will burn the chest. Clear? Are we good? So see, now you know how to read ECG. You take the ECG strips, you can see square, 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 right? Small square. All you have to do is to count. From here, 1, 2, 3, 4, 5, 6, 7 square, 7 square, 7 square, 7 square, 7 square, 5, 5, 5 square, 6, 6, 6 square. They are uniform, normal sinus rhythm. Your ECG is normal. But if you see on your ECG like this, is this normal? Tuk tuk, tuk tuk, right?
Means the
Means
interval gap should be same.
the gap is too long, so your heart is very slow. Tuk tuk.
So Should be 7.
Tuk tuk. It should be this one. Tuk tuk. Tuk tuk. Tuk tuk. Tuk tuk. 80 to 100 beats per minute. How many square? 7 square, 5 square, 6 square. Get the ECG. Look it in the Google. Count the square. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6, 7. That's how you read the ECG. It's easy.
I don't know. We don't know.
That's not it.
Right?
Yes.
Are we clear?
Yes.
Okay? Any question? So you can perform what we did?
So the second person, while he bringing AED,
While he's getting the AED, the only thing that you need to do is to compress the chest. When he arrived,
we start.
set up the AED. When he attached the pad, stop. But when you see him, don't stop. Okay? When he attached the pad, stop.
Okay.
But first you turn it on. Turn it on and then attach the pad. Sir.
For example, if my colleagues went to bring the AED, you request him to call the ambulance.
Sir?
If example, my colleague now he went to bring the machine, the AED, you will request him to bring to call the ambulance, 999.
You have to continue.
No, but the thing is once he called the ambulance, they will ask him many questions, so you have to be near the patient.
No, it's okay, sir. I'm getting the AED. The victim's already unconscious.
Because
We're starting the CPR.
we called many times ambulance and the first thing they ask you is, are you with the patient?
Yeah,
The
tell
AED is-
the victim, sir, I'm here, I'm getting the AED. Because the victim is totally unconscious. I'm on my way to the patient,
Or we can have the person.
Yeah.
To call the ambulance.
okay? Are we good? Because if you're not going to do something, don't wait for this. Because after this, you will deal with this.
Once AED connect, we will
Connect.
follow the AED instruction.
Turn on first the AED.
Okay.
Listen to the instructions. Okay? Don't attach the pad. Listen first to the instruction before you attach the
Attach.
pad. Okay? When the AED arrives, don't attach the pad. Turn on the AED. And then listen to the instruction steps by steps. Are we clear?
Yes.
Clear?
Yeah.
Alright, take your second break, guys. There's no information over it. Wait, guys, what's your first aid for nosebleed?
Sorry?
Nosebleed. What's your first aid for nosebleed? One guest approach you, he's suffering from severe nosebleed. The nurse is not around. Head up, head down. Head down. Pinch the nose. Open the mouth. Breathe in the mouth. You get the ice, you put it in the forehead, not on the back, huh? Forehead here. Don't head up. You swallow the blood, you suffered from infection or you suffered from mild choking. Clear? Okay. Take your second break, guys.
Like this, no? Yeah. Close plate always like this.
Si Martin nagdala sa amin.
Sir, question.
Madam? Yes, madam. 5 o'clock, 5:30 work.
You will do the
You said 5. I will not have.
you will do the first presentation.
After this, you go for 3 more topics and then you go to the practical exam.
Can we do the other way around?
Yeah, we can do that. Don't worry.
So I can.
Yeah. So always we are doing like this, no split, but first we do this, no?
Bring your legs. Bring your legs.
Parang kita natin yung i-do natin first dito, masalang
Bring your legs.
yung mga bago eh. No?
Saan ba nakalagay?
Pakuha ko lang.